Welcome to this edition of Compassionate Conversations. My name is Lynn Flanagan and I'm the CEO at Ancora Compassionate Care. Compassionate Conversations is a platform that we use to connect with, care for, and support the community that we serve. A lot of times that support comes in the form of education, and that's what we're here to do today. So we've got lots of wonderful things that we're going to dig into about advance directives. We're going to get into the details of maybe the 5 wishes document, most forms, lots of things like that. So joining me today is Megan Cole. She is the director of our support services here at Ancora, and Kayla O'Boyle, who is the team leader for support services. Thank you so much for being here.
Thanks for having us.
Yeah. So before we jump in, what would you have our listeners know about you, Megan?
So again, my name is Megan. I'm the Director of Support Services here at Ancora Compassionate Care. I am a licensed clinical social worker, and I have been on staff here at Ancora for about 12 and a half years. I was one of the social workers seeing patients at homes and facilities for about 8 years, and then moved into my present role. And at home, I have a husband and a little girl. She is 4. And we're talking about advance directives today. I actually just put my own in place so that in the event that something should happen, I have my wishes documented so that my family knows what I want done if I can't tell them myself.
Yeah, very smart. So we're going to dig into that a little bit more because we do have an internal campaign that we're getting ready to start here to make sure that we are walking the talk, so to speak, when it comes to our own advance directives. So, Kayla, what would you have our listeners know about you?
Hi, my name is Kayla O'Boyle. I'm also a licensed clinical social worker here at Ancora Compassionate Care. I've been here for about 4 years and started as an intern through the UNCG program. At home, I have a husband and a 1-year-old little girl, and they support me every step of the way, so I'm excited to be here.
Thank you. Time flies.
Yes.
1 and 4. Oh my goodness. That is crazy. And when we think about making our own wishes known, I think we need to think about that even broader, because think about what you said when you said you had just completed yours and you all are having conversations at home about what you would want done. Mm-hmm. But I think sometimes what people don't think about is what a gift that is for the people that care about you.
Right.
Is that a fair way to present this, that it's not just what I want, but it is a gift for the family?
I think so. Just in my own, personal life, we had the honor of caring for my grandfather at home under hospice services until he passed away in July of last year. And his wishes were very well known. He was very vocal about it. He made it very clear verbally and in writing, that he wanted to be home, that he wanted to be comfortable, that he, wanted all of us around him. Mm-hmm. But not everyone is as comfortable talking about that, right? Mm-hmm. And sometimes we have the conversation with some folks, but not with others. And sometimes the people that know our wishes may not be available if the worst should happen, mm-hmm. right? So the beautiful thing about this 5 wishes document specifically is if the time ever came that I could not speak for myself and I was facing a major medical emergency or a life-ending, situation, the people caring for me would know who to contact if they weren't already there, and the people that I have designated as my powers of attorney would know here is step by step what I want them to do for me. Mm-hmm. And that's something, even doing this myself and doing these countless times professionally, doing it on your own, I had to really pause and think, okay, well, if this were to happen, what would I want them to know? Mm-hmm. What are the things that matter most to me, and how would I hope that they would feel about these decisions? Mm-hmm. So this is definitely a very thoughtful and deliberate process that you can't give your family a better gift than knowing that if they can't tell me what they want, I can read it right here.
Right.
I'm
going to back up just a second, just because I want everybody to completely understand. When we hear the words powers of attorney, mm-hmm. They're actually different. So just give us a brief description either one of you, of difference between a durable power of attorney and a healthcare power of attorney?
Sure. So I can answer that.
Yeah.
Durable power of attorneys are for finances and for financial obligations. Typically, those are done with an attorney or through an attorney's office. However, the healthcare power of attorneys, that is something that any of us on staff who are notaries can complete for someone, and they carry out healthcare decisions only. And those go into effect when a person can no longer make decisions for themselves.
Okay, and I just wanted to make that distinction because sometimes I think that by itself can be confusing. So needing an attorney for the financial, your personal business end of things, but don't necessarily need an attorney for the healthcare power of attorney. Thinking about the 5 wishes, if somebody were to have that document and complete it and then have it notarized, are we good to go?
You really are. The 5 wishes covers just that, 5 wishes. The first wish is the actual designation of a healthcare power of attorney. And you can choose 3 people. They do not serve together. So I chose my husband as my first healthcare power of attorney, and then 2 other people that if he was not available, then this person. If that person's not available, then this person.
Right.
So that I'm well covered. You know, if they
Right.
can't reach one, they have other options. So that's the first wish, is who I want to make my decisions. Our second wish is the kinds of medical treatment that I might or might not want. So that can be things like blood transfusions, IV antibiotics. It can be life support of different nature, like dialysis, ventilators, feeding tubes. It really is, up to you to define what that medical treatment would look like and under what circumstances. So some people might say, no matter what, I want everything possibly done to prolong my life and give me every chance. Other folks might say, if I've had a catastrophic event, maybe I've had a big stroke or a heart attack, if the doctors are telling my family that I'm not going to have any kind of meaningful recovery, let me go, turn the machines off. And this document kind of gives you the ability to set those parameters, what that looks like specifically for you in more detail than some of the other more traditional healthcare powers of attorney or living wills would. The third wish is about our comfort. So for me, and this document, it talks about things like, I want to have a bath, I want to be kept clean, I want clean linens on my bed, I want to have lotion. Mine says, please keep chapstick on because I don't want to have chapped lips.
Right.
And it says, please play music, but not the kind of music I don't like. Here are my playlists.
Right.
Please find my playlists. Don't have a TV blaring in the room because those are things that are comfort to me, right? So it can really be that personalized. The fourth wish is how you want people to treat you. One of the questions that I liked on this form is, what do you want people to call you? If you call me Mrs. Cole, I'm not going to know who you're talking to. That's just not how we refer to me, anywhere. Call me Megan, even call me Mama because I'm used to hearing Mama about 1,000 times a day. But don't call me Mrs. Cole. Things like that to really help people understand who you are and what matters. And then the fifth wish, and the one that really makes you think, I think, is what you want your loved ones to know. So that's things like, even after you've passed away, how you want to be remembered. If you have a funeral pre-need done somewhere, where. If you would rather have a burial versus a cremation, if you would rather have donations made in your honor to a charity, all of that can be specified right here. I've never seen another document that is so encompassing of that healthcare continuum, and it really gives you so much opportunity to individualize just what you want. None of these are going to be just alike, no
Right.
two, and that there's a lot of beauty in that.
And I think it's important too to think, so as you've completed this, I have things in place for myself, but it was where I was at that point in my life right then. So I think it's important that once we get over the hurdle and you start having some of these conversations to begin with, as we age, as our life situation changes, our thinking about some things may change.
Oh, yeah.
So it would need to be updated.
Absolutely.
And you know, the interesting thing about the name, until sitting right here, I have never even thought about this, even though we deal with it all the time. My husband goes by Scott, but his first name is Curtis. And if you call Curtis, you're either a telemarketer or, you know, clearly you do not know him. That's actually an interesting point.
Well, and how many times do we see that caring for patients, you know,
right.
that, you know, their name is John, but they go by Jimmy. And
Right.
you know,
Yeah,
that's
who
how
would
they
know
know you don't know
Yeah.
me. So
Yeah.
it really kind of helps, I think, the patient and the family feel more comfortable. And it would definitely me if someone called me by my name that I go by instead of
Yeah.
whatever the paperwork says, you know.
So what would you say to people, Kayla, as far as when we need to start this? You know, what we do, obviously with hospice, it's end-of-life care, and we have a lot of those conversations. But when would you tell people you think is the best time to start this?
Well, that's interesting because if you asked me before I was a social worker here, or even before a mom, I would say, don't worry about it.
Yeah.
Now that I'm a mom, immediately. But even before then, as soon as you can get your resources and people together to get this completed, I would get it completed. And like I said earlier, I have a 1-year-old daughter. This has been on my mind. This is something I'm going to get completed ASAP.
Yeah. Good. Yeah. Those babies have a way of putting a lot of stuff in perspective, doesn't it? But you know, when you think about it, this could actually be good for families to do together.
Absolutely.
But I will tell you from my own experience, even in my own family, this is uncomfortable. So what do we, it's not uncomfortable for us, this is what we deal with and what we do for a living all the time. What can we share with people to help them be more comfortable? How can we, maybe a mind shift or a perspective shift about what this is really for? If somebody's uncomfortable, what would you say to them to try to get them started? To me,
Okay. That, you know, that is a tough question.
Yeah.
And it's a difficult topic. Like I said, it took me a long time to put mine together, and I got quite emotional. I was surprised, you know, filling this out and thinking through some of the questions and picturing my end of life. That's a hard thing, you know, and having the conversation maybe with my parents or living it with my grandfather last summer. It is just such a blessing to know that they know what to do. You know, I used to work in a hospital where families had loved ones on different kinds of life support for prolonged periods. In very, very few cases, virtually none, was there any kind of a living will to talk about what the person wanted.
right.
And so the person had been sometimes on a ventilator, a feeding tube for months and months, and the family would meet with the physician and make the decision, okay, we've got to terminate life support. And seeing how much they agonized over, is this the right thing to do? Is this what she would want? Is he going to be angry with me that I turned this off? If I could spend an hour with someone and save their family the grief that I watched so many families go through as they weighed that decision, it's worth that little bit of discomfort to save the grief on the other end, you know.
And not to make light of it, but the bottom line is, not having the conversations does not make us immortal, right?
No.
You know, heaven
Right.
forbid, I pull out of the driveway going home and a transfer truck just creams me
Yeah.
and I can't speak for myself. Nothing in writing.
Right.
Now, husband and I have been married 30 years, so he's aware. But What if I was 21, not married? Somebody that cares for you needs to know
Yes.
what to do. So in my mind, it is truly a gift
Yes.
that you can give to people who care about you. And so I agree with you. It's worth a little discomfort. And we see on the back end of things, after patients have passed away, families, it's never going to be easy, but that bereavement period may be easier if you know, hey, we did this exactly like
Yeah.
Mom wanted, or my brother wanted this,
Exactly.
and this is what we did, and I'm at peace with that,
Yeah.
as opposed to second guessing yourself, and that doesn't go well. So, okay, let's. I want to switch gears just a little bit. So you have another form there that some people may not be familiar with called the MOST form.
We do.
Let's talk about that a little bit.
So this form, if you see it in a physician's office or in a hospital, it is actually going to be Pepto-Bismol pink. I was able to print it off white so that we could actually read it because it is shockingly pink. And it's a little hard to read, but I guess they made it hot pink so that it's very obvious
What it is.
and where to find it, MOST stands for the Medical Orders for Scope of Treatment. This is essentially a list of physician's orders that a doctor or PA or nurse practitioner will review with a patient and their family. This is not a form that you would have filled out and signed when you're generally considered to be in good health, when, you could, but this is a form that is more for folks usually within the last year or two of life, where they're probably getting a lot of doctor's visits, a fair amount of hospitalizations often, where, they're kind of moving in the direction of end of life or comfort care. And it's, everyone has heard of a DNR, a Do Not Resuscitate form. This is a more comprehensive version. So the MOST form actually gives you the option of saying, yes, I want you to attempt CPR, or no, I don't want you to attempt CPR. It gives you the option to be fully aggressive with any kind of treatment measure the physicians can give to try to save your life. To use limited interventions, so maybe medications, but not a ventilator or any kind of combination. And then there's full comfort measures where it would just be a focus on transitioning to end-of-life comfort care, no life-sustaining treatments. It covers whether or not you'd want antibiotics, whether or not you would want a feeding tube, IV fluids. All of this is covered, and it also talks about who your family members are who understand these wishes. It is signed by the patient or their family member, and it is signed by the provider. So everything is kind of right here. It's like portable doctor's orders that can go with you.
But even though that is completed by a provider, the conversation with your loved ones still needs to take place.
Absolutely.
Right? And making sure everybody's on the same page. So make sure I've got this right. So I have learned that, let's say I have a MOST form. I'm in my own home and something happens, I have a fall, something, and 911 is called. That form can go with me and kind of speak for me even before we get in touch with family members.
Absolutely.
Is that one of the advantages of having that?
It is. And, it would be great if everyone that had this, I would take it to your physician's offices once it was completed and have them scan it into their records. I would probably keep a copy in my glove box of my car, give one to my power of attorney, but I would also keep one probably on my fridge or, somewhere very visible. Like I said, it's hot pink, it's hard to miss, but that way, if the paramedics are called, they're going to look for this form or they're going to look for this yellow form, and they're going to know just very quickly, okay, here's what they want, here's what they don't want. And it's, it's a gift for you to know that your wishes are being followed, but it also helps first responders know that they're honoring your wishes.
So is one more beneficial than the other, or do they go hand in hand? Can you have one without the other?
You can have basically all three of these. The most form, like I said, is a set of medical orders signed by a provider. So it is a very comprehensive list that any healthcare provider, any hospital would honor, knowing that your wishes for your medical treatment. The 5 wishes is more of a guideline that is asking your family to follow as your healthcare powers of attorney, or whomever you just decide to be your power of attorneys. The Do Not Resuscitate Order is the one that is for people who are typically at the very end of life, the last usually months to years, I should say. And in this case, it's just talking about CPR. So you could very well have all 3 of these in place. The key would be to make sure that they all follow the same wishes, and it says right here, do you want CPR or no? This says, I do not want CPR. And for your family's sake, you're going to want to make sure that the 5 wishes also says, I don't want CPR.
Okay. Interesting. So lots of things that could be helpful, but I think we have to go back to the very beginning, which is having these conversations, but really encouraging everybody to put some thought into who would you want to make decisions.
Yeah.
Do we ever run into a situation where maybe there isn't family? And so how do we talk to patients about that?
Well, that does come up. And another common thing that we see are default healthcare power of attorneys. When you don't have these documents in place, let's just say my husband is my default power of attorney. What if I don't want him to be? Then that's another important reason why we need to have these filled out, because sometimes there's family dynamics where we just don't want the default person to be our person.
Right.
And that's okay. So just having the conversations, like you said, early on, having even folks that you think could come in and help mediate the conversations, whether that be friends or staff from Ancora, we can help do that as well. And then if there is no family, we do have other options as far as people can reach out to good friends if they feel close. We also have several folks who have legal guardians who that goes hand in hand with them being their power of attorney or knowing their decisions.
If we have a family or a patient that we sat down with and they did not have anything in place, we would explain in the state of North Carolina, there is a chain of decision making, and it's actually a law that in the absence of a written healthcare power of attorney, there are basically chains of people that would make your decisions. Starting with your closest relative, of course, so your husband or your wife, your spouse, your parents, your adult children. If you have multiple children, there is a very common belief that it's your oldest child. That is true in some states. That is absolutely not true in North Carolina. In North Carolina, it is the majority consensus of the children. So if you have 2 children and they're on different pages, it doesn't work very well. If you have 3 children and it's 2 against 1, the 2 can make a decision, but you're making it very difficult for their relationship. And then it can go all the way down to grandparents or grandchildren, nieces and nephews. In the absence of any blood relation, it can be, just a good friend or family, neighbor, something like that, who knows you and knows what your wishes are. But that gets really complicated, and that's putting a lot on someone that may
be very far removed.
Exactly.
Right? Yeah.
So, it's free for us to help you get these set up. It would help you know that your wishes are being honored, that the right people are making decisions for you. It has come up quite a few times where we've had spouses who were separated for sometimes 20 years or longer, never bothered to get a divorce, and we say, hey, you know, I know you've been separated for 20 years, but did you realize your spouse is still your default healthcare proxy? They're still the one that's going to be called on first, and that's usually not what you would want. So in that case, it is so important that you start having those conversations and getting things put in place formally to protect your wishes.
So if it were me, I would like all of my healthcare decisions to be made by me, if at all possible. And that to me is what a lot of this is about, just in the future.
Yes.
And here's what I'm thinking about this situation, here's what I would want. Communicating that to people that I love and that care for me, that support that I just handed them is invaluable, because now they know. There's no second guessing. You know, if we get in a crisis, emotions are all over the place anyway.
Right.
These help us then focus back on what did Lynn say, what did Lynn want, what's important to her.
Exactly.
And I think once you complete the 5 wishes, I'll just say, once you do it one time, as things in your life change, as we age, whatever the case may be, it's even easier to go back, and then you're just making tweaks as opposed to never having that conversation to begin with. You know, there's, I was in a meeting yesterday and learned from a lady, a campaign that they use in their organization that she termed as "Know Us Before You Need Us." And that goes right back to this, even though that's not an us, they're forms, but hey, know about it before you need it.
Yeah.
We don't need to be in a crisis trying to make what we think is the best decision at the time, when you can have something that says, well, you know, this is not what she would have wanted, or he would have wanted this right here.
Right. And it's also important to know that these forms, if I'm sitting up and I'm in my doctor's office, they're not going to look at this and go, well, I'm sorry, Megan, this is what you said, so this is what we're doing. As long as I am in my right mind and I'm able to understand the consequences of the decisions, I make my own decisions regardless of what these papers say. These forms only go into place if something were to happen that I am physically, mentally incapable of making sound decisions for myself, whether that's because I'm in a coma, I've had a stroke, I'm in surgery and an unexpected complications come up and they need to know, the physicians need to know, okay, now what do you want us to do? You know, this is not, I sign it and make Kayla my power of attorney and I immediately
Can never make another decision.
You know, that doesn't put Kayla instantly in charge. It means if I'm ever unable to speak up for myself, I know that Kayla knows what to do for me.
And I think that is a huge point, and I appreciate you bringing that up, because I do think some folks, some in my own family, it's almost like we're not going to talk about it because we'll speak it into existence. And that's not how this works.
Right.
But if you think about everything else that we plan in a family, you plan weddings, we plan for babies, we have graduation parties, you plan vacations, but we haven't been on the vacation yet. We're just putting things into place. But if we didn't plan and we just showed up for vacation, we don't have a place to stay. I don't know where we're going to eat.
Exactly.
That may sound very simplified, but I think about this the very same way.
Well, and you think about when a baby is born. That's such a beautiful example, the circle of life, right? Yeah. When a baby is born, we welcome them with love. They are snuggled, they're warm. Everybody who cares about them the most are right there, right? At the end of life, when we're saying goodbye to someone that we have loved for so many years, like with my grandfather, to have had the honor to be surrounded with my aunts, holding his hand, and my grandmother beside him, and all of us just loving on him and singing and praying him home, I would never trade that experience. And he gave us that by making us know what his wishes are. Right. Instead of dying in a hospital, hooked up to all kinds of life support.
That he never wanted.
That he never would have wanted and would have been horrified to have had. You know, so what a beautiful gift we were able to give him, but that he gave us.
Absolutely.
You know.
And if you look at all the surveys, the majority of Americans want to pass away at home, and they want the things that you listed off from the 5 wishes, But the sad reality is that most of us, it doesn't go that way. This is a simple way to ensure, as best we can,
Right.
that it's going to go the way we want it to go. Yeah. So I appreciate everything that you brought today. I think it's so important. And I do want to tell our listeners that we are taking this so seriously inside our organization. Yes, we do this for other people all the time, but we are going to start our own internal campaign called Walk the Talk as a way to support our employees and just say, hey, we can't just talk about this on the outside. Have we got our own business in order? So that's going to be interesting. I'm looking forward to that. So if you need any more information, or you ever have any questions about anything you hear on Compassionate Conversations, or just would like some more information about Ancora Compassionate Care, please feel free to give us a call at 336-427-9022, or you can actually visit our website at ancoracc.org.